today at Preventx, and I'm joined by Chris Jelly, who's the CTO here. I want to talk all things digital transformation and just understand more about the Preventx business and really the journey that they're going through from a digital perspective, as well as serving their customers what's been quite difficult times through the pandemic and looking forward to future opportunities. Hi Chris, could you give us a bit more background about what you do at Preventx and your role? I think that would be a great place to start.
Yep, so I'm Chief Technology Officer at Preventx. We've been going since about 2008 as a business, and we're a fully digital, remote, self-sampling, sexual health testing business. I think at the heart of our business is, two things really, to bring it all into one. It's the power of our innovative health tech platform, coupled with our state-of-the-art lab. Yeah. And I think that as a business allows us to drive through innovation within the remote testing sector to make health sort of accessible to everybody.
Could you tell us a little bit about that transformation journey at a bit of a lower level in terms of from the digital platforms and moving to Azure and what that's given to you guys as a company?
As a fully sort of digital health tech business, but also having a fully physical lab, there was a real requirement very early on to make sure that we protected the people who had to be here 24/7 in the lab, while also providing the capability for the people who could work remotely to still deliver the real sort of high quality, highly responsive service that we provide to our service users and our customers. We started initially at our internal infrastructure level. Okay, so we introduced data loss prevention policies in 365, multi-factor authentication using conditional access, and as part of our move to public cloud, we changed our gateway. Our gateway is here internally to use. We bought some Meraki devices to bolster our sort of external perimeter. With redundant connectivity to the WAN and our MSP's data center, where we hold our sort of domain controller and some of our Preventx core apps. Some of the driving force with that was around that was the NHS themselves, who have a public cloud first policy as part of their architecture principles, their main architecture principles. But the other one was the existence for me of the UK official NHS government blueprints, which give you a sort of set of governance guardrails to allow you to appropriately manage and look after sensitive data. Yeah. Customer experience for me is the key to everything going forward, both in terms of the customer and equity of experience we have. We give our employees, whether they're fully remote or fully physical or a mixture of the two. And it's the same for our service users and our clinical users. If we can give people great customer experiences, then we believe that we can improve the lives of the service users that we support, but we can also improve the efficiency of our NHS colleagues to allow them to do their job better.
So how did you find that whole experience of working through adopting Azure, and how was that experience of you working with N4?
We really needed a partner who could work alongside us, could help to bring up our skill level around Azure, but that we were also very comfortable that they understood the context and the environment which we were working. So we went through quite a lengthy, as you probably remember, RFP process, and it became very clear very early on that the number of potential providers was very small when you got down to the sort of criteria, when we got down to the kind of criteria that we were measuring those businesses against. And for me, it was fairly clear that N4 provided the level of technical depth plus the knowledge and experience within the healthcare sector. Not only because you've worked with other healthcare businesses and you continue to work with other healthcare businesses, but you had a real deep knowledge of the real challenges in our sector. When it came to the migration, the day of the migration, you know, that showed itself by the extent and the lengths that you and your team went through to make sure that that migration, which happened overnight on a Saturday, as these things always do, went without hitch.
Yeah, I think that's a great way of looking at it, that you've got specific customers or users, either internally or externally, you know, and driving that experience. At the end of the day, that's what you're here to serve, I guess, that technology element to make sure everyone has a great experience.